Many years ago, I started working in the school space. And over the years, I've faced quite a number of challenges, especially when I was a classroom teacher teaching grade 3. I actually had a miscarriage while at work. Don't feel pity for me. It is part of what I'm talking about today. So while at work, I was rushed to the hospital. Had a miscarriage then. After a few days, I had to get back to work. Also, during my years in the classroom, there has been constant complaints from parents. Most of the complaints are baseless with no evidence. I've had to deal with hostile colleagues at work saying mean things and trying to jeopardize my work. And the supervisors or my line managers over the years, some of them have been wonderful while some don't usually give me good feedbacks. So are you like me, having quite a number of challenges like this in your place of work? During those years, I had mental health problems due to miscarriage at work, due to when I even had my baby. I had to bring my baby back to work when it was just 2 months. So the stress of coping with the deadlines at work, the things I need to do as a classroom teacher, and also catering for a 2-month-old child, which I bring to work, and a number of things has been quite challenging for me during my time over the years. So what am I trying to say? That education stakeholders, we're talking about that, we're talking about policy makers, school management staff, administrators, educators, support staff, parents, and even the learners themselves. We should be intentional about creating policies that support emotional and mental health of teachers. Because some schools, especially private organizations, they don't pay teachers, they don't have policies for maternity leave or even special routines for nursing mothers when they resume to work. So mental health is very important. We need to take it seriously. Policies that has to do with mental health to be in place in our schools. Also, there should be counseling sessions or counseling department, especially for employees at work, not just teachers, support staff, administrators, everybody that find themselves in the school system should be able to talk to somebody about their mental health challenges. When I had that miscarriage, it was an hush-hush situation. Africans who didn't want to talk about it, and I just find myself in my own little way. My husband helped me to come back to myself and resume work. So join me for the Mental Health Spark Up for teachers, educators, and other education stakeholders on the 3rd of May at Lagos Island, and on mainland on the 17th of May. The details will be showed on the flyer. Thank you. I remain Eso Oluwatoye, the advocate for excellence and positive mental health. Bye.